My name is Jaskiran Kaur, and I'm a student at Indiana State University in Nursing 444. This is my community health project regarding hand washing. So, first of all, let's pause here and do the pre-test that is attached here under description. So my objectives for these presentations are identify who should practice hand hygiene, what hand hygiene is, why hand hygiene is important, and describe when hand hygiene is to be performed. Describe how to perform hand hygiene using different steps. What is hand hygiene? Hand washing, also known as hand hygiene, is the act of cleaning one's hands with soap and water to remove viruses, bacteria, microorganisms, dirt, grease, or other harmful and unwanted substances stuck to the hands. Hand hygiene is considered a primary measure for reducing the risk of transmitting infections among patients and healthcare professionals. Why hand hygiene is important? Hand hygiene is very important to avoid the transmission of harmful germs and prevent infections. Hand hygiene is the best way to stop germs from spreading. And the picture on the right, it says germs are tough, and it mentions some facts that says viruses can be transferred from dry, smooth surfaces up to 20 minutes after being contaminated. Some viruses can travel on droplets through the air. E. coli, salmonella, and other bacteria can live up to 2 hours on surfaces like doorknobs, keyboards, tablets, etc. Bacteria double every 20 minutes. 5 bacteria in a sandwich at 12 noon will total over 10 million by 7 p.m. After 3 days with no bacteria dying, there would be enough to cover the earth. Microorganisms can build up resistant to drugs intended to kill them. Hot water will not kill bacteria, only temperatures over 140 degrees can kill them. When should I wash my hands? So we should wash the hands like after arriving from somewhere, after coughing or blowing your nose, before making or eating food, after playing with animals, after using the toilet, after playing outdoors, before and after changing contact lenses. So for everything, just wash your hands. Who should practice hand hygiene? Any healthcare worker, caregiver, or person involved in direct or indirect patient care needs to be concerned about hand hygiene and should be able to perform it correctly and at the right time. In general, everybody should practice hand hygiene. So don't forget, wash your hands. This slide will just mentions about like how to wash your hands, like how to scrub and between the fingers and nails and everything. So the right way to wash your hands is so wet your hands under running water, apply soap and rub palms together. Spread the soap lather over the backs of the hands. Make sure soap gets in between fingers. Grip fingers on each hand. Make sure to clean thumbs. Press fingertips into palm of each hand. Dry thoroughly with clean towel or paper towel. This slide just shows how the coronavirus hand washing affects. Say 78% of Americans are now washing their hands 6+ times a day. 20% of those Americans are washing their hands 16+ times a day. So that's just a fact. Here are some tips. So wash your hands regularly throughout the day. Wash for at least 20 seconds. Use any temperature water, but like warm water is good. Any soap should be okay. And this picture is just kind of funny. It shows wash your hands, you know where there have been. Tips continued. Combat dry skin with hand cream. Use hand sanitizers if soap and water are unavailable. Encourage children to wash their hands. and take care when drying the hands. What if soap and water are not available? Washing hands with soap and water is the best way to get rid of germs. If soap and water are not available, use an alcohol-based hand sanitizers that has at least 60% alcohol, and wash your hands with soap and water as soon as you can. Your hands carry germs you can't see, so wash your hands. We often forget to wash our hands. If we don't wash our hands, it can take a life away. It is a good practice to keep washing your hands. So don't forget to wash your hands. Um, Washing hands prevents illnesses and spread of infection to others. Hand washing with soap removes germs from hands. This helps prevent infections because people frequently touch eyes, nose, and mouth without even realizing it. Germs can get into the body through eyes, nose, and mouth and make us sick. Germs from unwashed hands can get into foods and drinks while people prepare or consume them. Germs can multiply in some types of foods or drinks under certain conditions and make people sick. Germs from unwashed hands can be transferred to other objects like handrails, tabletops, toys, or and then transferred to another person's hands. Removing germs through hand washing therefore helps prevent diarrhea and respiratory infections, and may even help prevent skin and eye infections. Hand washing education in the community. So it is very important to educate our community about the hand washing, especially with this current pandemic. Hand washing reduces the number of people who get sick with the diarrhea by 23 to 40%, reduces diarrheal illnesses in people with weakened immune system by 58%, reduces respiratory illnesses like colds in the general population by 16 to 21%, reduces absenteeism due to gastrointestinal illness in school children by 29 to 57%. So these are some numbers that can go down by hand washing. So stop the virus. Wash your hands as many as times you can. So whenever you remember, just make sure wash your hands. I know it is easily like forgetful. Like we can just forget to wash our hands and then we touch everywhere. But it is a good practice to wash your hands all the time. These are the references you can look more information from about the hand washing. So thanks for watching.